you. Our guest today is Ani Papazyan, who is a pain resolution specialist, nutritionist, and lifestyle educator. With over 27 years of experience, Ani is a certified medical massage therapist and practitioner in advanced translational nutrigenetics and nutrigenomics. I will later ask the question what this is. Ani is the founder of Last Stop for Pain, where she empowers individuals to live pain-free lives through personalized nutrition and self-help techniques. Ani uses her expertise to help people make informed lifestyle choices based on their unique genetic makeup, enabling them to take control of their health and well-being. Ani is dedicated to helping others achieve their health goals and live a fulfilling life. Well, welcome, Ani. Please tell us a little bit also how you got into the field, which is a very unusual field, right? How did it all start? And anybody, just 1 second, if you can show your face, please do, but we will not make you. Anybody who's online, thank you. Go ahead, Ani.
And even if you have a glass of wine in your hand, it's totally welcome. It is Sunday evening. Well, thank you so much. Well, most of you are Russian. I finished the Institute Fizkultury в Armenia. So that's where I got my bachelor's in kinesiology. And then I also studied medical massage in college. So with my family, when we moved to United States right after college, I reinstated my diploma in United States. So then I wanted to continue my education to get my master's degree either in physical therapy or chiropractic. So CSUN, I'm in Los Angeles, CSUN has an amazing physical therapy program. So I went to over there, they look at my paperwork and they said, everything looks good, decide, it's a 2-year full-time student program. You have to go to orientation and decide when you want to start. So I'm getting all excited, I go to orientation, everything is great until the professor says, and we get 6 new cadavers every year. I said, yeah, that's not going to happen. I'm terrified of cadavers. I don't go to funerals. So I figured, okay, I studied massage. Let me see if there is no cadavers involved in massage school, I'll go to massage school. But because I studied back home, Russian medical massage is very science-based. It's very medical-based. It's not a spa massage. So I got my certification, and then I love pain relief. I played volleyball for Armenian national team. I knew that we always got massages. I knew what pain was. So I'm like, okay, I'm gonna just go and, find like unique, amazing doctors and practitioners that can teach me very unique pain relief techniques. And I was fortunate enough throughout the years to come across some amazing practitioners that created very unique ways of approaching pain. And I started with them. But if anyone here is any natural, practitioner, that sometimes body pain, muscle or joint or any type of pain could be due to like digestive issues or constipation or whatever. So after 15 years, I decided, you know what, I'm going to go and become a nutritionist. And then so I became a nutritionist, but more of a functional nutritionist, that I can order any blood test. I can look at the blood work nutritionally. And then a few years ago, I was at this webinar, and there was a guest speaker, a doctor that was analyzing the webinar host genetic report. And I went, that's what I want to study. That is so cool, to learn how your body reacts to your environment, the food you eat, the movements you do, the lifestyle choices you make based on your genetic makeup. So there is no guessing game. So I went back to school. I got my advanced translational nutrigenomics certification. And now I just combine everything, all of those together, pain, manual therapy, functional nutrition, and genetic testing to create the most personalized plan for clients, especially clients that have been living with chronic pain. So that's my story, and I've been doing this for almost 30 years. So today, I actually have, since everyone is off things, so no one can raise their hands, but I wanted to ask if anyone ever woken up with neck pain. I'm sure some of you have. And I'm sure
I think everyone did, especially
right?
after staring at the computer for too long. Or
Yes. So I'm sure you wish that you had some self-help techniques you knew that you could use right away to take care of that pain so it didn't get worse, so you didn't suffer a few days, or you didn't got on a phone call with your either chiropractor, physical therapist, or massage therapist, acupuncturist, just to say, you know, I need an appointment like right now. And that's what I love to do, is I love to share with clients, teach them self-help techniques so they can use it, or even teach the family members. Actually, a few years ago, I got a phone call with a client of mine with their family. They were driving Midwest, and she said her daughter woke up and she couldn't move her neck. If there is anything I could do. I said, well, if you can get on a video call with me, I can walk her through several techniques. I walked her through literally one technique. And actually, I wasn't planning, but I'll be teaching. I will teach that technique today. And you could see after like her trying that technique about 4 or 5 times, her neck range of motion increased by like 70 to 80% right away. So when these techniques work, they work right away. And that's the beauty of it. That's why I love them. Let's see, I made myself notes so I don't forget. So usually when it comes to neck pain, you know, there are more commonly known causes of neck pain that we all heard about it, like disc compression, cervical disc compression, disc herniation, stenosis. You can have neck pain due to arthritis, your posture, as you mentioned, Tatiana, you know, sitting in front of a computer for so many hours. But what a lot of times I address, and I see them, most people have neck pain due to the causes that most practitioners or doctors do not address. And the causes I'm talking about is jaw clenching or grinding your teeth, lymphatic congestion, seasonal allergies, poor breathing habits. These are all can cause neck pain. In my office, over 85–90% of the clients that I see for neck pain is due to their jaw clenching and grinding and tongue tight. And when I do a lot of intraoral release, when I put gloves on, go inside the mouth and release some muscles, and the clients, they're surprised. First of all, they're surprised that their jaw is tight, and they're surprised to see how much after like literally 10 minutes of me doing that, their neck goes 90% soft. And I haven't even touched their neck yet. Especially tongue. They're like, how much? Well, what do you mean my tongue is tight? It's amazing. I've had a couple of clients, females in their 50s, that all these years they lived, they didn't even know they had a tongue tie. That when the frenum is really tight, yeah, that they weren't even able to stick their tongue out. And I'm like, how is it you're in your 50s? Hasn't your dentist ever mentioned anything? And I had to send them to a local professional that I work with, that I refer clients to, and their specialty is cutting the tongue tie. But
wait a minute, is that the ability to lift the tongue up?
yes.
Oh.
Yeah, touch the tongue. Like some people, if your frenum is too tight, then you won't be able to touch your tongue to the roof of the mouth or even stick your tongue out.
My understanding that most of these people have some sort of speech
They could have,
yeah.
they could have lisp.
Yes.
There's a bottom lip could be very thick. It can change the structure of your mouth also.
Yeah, my third son was born with the lisp. It took us 5 years and 5 different speech therapists to get rid of the lisp. So we started at age 5. By age 10, we got rid of the lisp. But it was such a long answer. I wish I knew you. You would probably help us faster.
Well, I'm not a speech therapist, but I can refer to, and yeah, so it's really important, but you don't connect those to neck pain, you know? So let's see, before we get to techniques, I want to say that a lot of times people don't think about that seasonal allergies because they cause inflammation, you know, and I just want to address the seasonal allergies really quick. You know, a lot of times you'll end up taking antihistamines, whether it be Claritin or you go more a natural route, hopefully. But as you're doing it, and then they still keep eating the foods that are histamine triggers. Common known foods, which are also considered as health foods, like spinach, like avocado, banana. These foods are very high in histamine. Actually, spinach and avocado, eggplant are very high in histamine. Banana, the fermented food, hard-aged cheeses, dried fruit, those are all histamine triggers, especially if genetically you have certain genes that makes it so your body holds on to histamine longer, it doesn't degrade, then you have seasonal allergies, you have all this inflammation, all this nasal congestion stuff going on. You're taking anti-inflammatory, and then on top of it, you're eating all these foods. It's a vicious cycle. Like you're trying to get rid of something, but and then you're putting it back.
Annie, how can we know we have those genes? If you can briefly.
You have to do genetic testing. There are usually the company I work with, they test two genes, DAO and HTMF, I think. There's a couple of genes. If you have the specific genetic variant.
MFTR, no?
No, MTHFR that you're talking about, that's a methylation gene. That's completely, I think it's HNMT and DAO for sure. For sure, I know. But if you have those genes, then your body can hold on to histamine much longer. It can linger in your bloodstream much longer. But if you have any like seasonal allergies, try to, especially when it's like really bad, your allergies, like right now, this is the season, you know, springtime when everything starts blooming. Try not to, for a few days, not to eat those foods. And on top of it, if you're into more natural stuff, then you can use wild oregano oil that helps degrade the histamine. You can use berberine. That also helps degrade histamine if you like more of a natural stuff. Okay. And then let's see, lymphatic congestion also, you know, on our neck, we have major lymph nodes here. So usually I like to, if you want to, you can go and get a lymph drainage massage, but it's something that you can do simple at home. You know, just the movement, any exercise will increase the lymph drainage. But if you have mini trampoline, you can bounce on a mini trampoline, that would work amazing. Also, if you have a vibration plate, even better. Vibration plate works great. Or if you have
what is vibration plate?
Vibration plate, it's this like a little like machines, or they have like the huge ones in some gyms. You stand on it and it vibrates like this.
Okay.
And
I have this kind of machine, but I didn't know it was called vibration plate.
Yeah, vibration plate, and it's amazing because it just stimulates lymph drainage. Or you can go very low tech like I do, a brush. I have it next to my computer. Literally, sometimes I just grab it. First, I kind of go and tap on the drainage, like the left thoracic duct and the right duct. I just tap it for a little bit to open the ducts up. Because first you want to open them up so there is a place to drain. Otherwise, you're going to get it congested even more so. So then I just get my brush and just kind of brush it. It feels great. And it stimulates, blood circulation, gives me a little glow. And then I just, do the full.
Is it true that you need to do it with a special, let me show you how, like up,
It's always, so with
it's
the
always
lymph
up.
drainage, yes,
Yeah.
you always go towards the heart. But one of the things that people do it backwards is, so first you have to open a place. So the lymphatic fluid has this room to drain. Then you don't start from here. You actually start here. So you go upwards here, and then you work yourself down the arm. Because if you start from here and it's congested here, it has no place to go. So you work backwards, and that's all the way through your body. And you have major lymph nodes, like I said, on your neck, on the armpits, in your abdominal area, in your groin, behind your knees. Those are like major lymph nodes that you want to work on draining. And then if people have any they get into accidents, they have concussions and things like that, then at the office, I would do lymphatic drainage. And that's a lymph nodes draining from the brain.
How would it look like in general, if you describe it? You said the brain, so you do something, movements with the head.
So I'm holding, let's say it's the skull, it's the neck, like back here. I'm holding their head like this, like cupping. And then my other hand is here. And literally I'm doing gentle compression, and my hand I'm pumping. Compression and pumping. So it creates literally like a pump, and it drains the lymphatic fluid from the brain. It's called lymphatic drainage.
All right, I'll write it down.
It's really cool. It's really cool. Like I've had, sometimes I get patients that had concussions, and it's very helpful for that. Now, with the poor breathing habits, that can create so much neck tightness. And, breathing is such a kind of an involuntary thing. We don't think about it. We just kind of do it. But especially if someone is doing mouth breathing, then you can definitely, first of all, your diaphragm will get tight, and then you'll be overusing these muscles. So then, like I said, your diaphragm gets tight. Well, when your diaphragm gets tight, we don't think of it, your diaphragm attaches to, it's so many muscles. It attaches to, you have your sternum, on the bottom edge of the sternum, xiphoid process, attaches to there. 6 to 12 ribs attaches to the side. In your lumbar area, attaches to your lumbar 1, 2, 3 vertebrae. So anytime you take a breath, all those, and intercostals, the muscles between your ribs. So every time you take a breath, it's like tons of muscles, they just expand and relax. So when you're not using those, everything gets tight. Like a lot of times in my office, when I test if their diaphragm is tight, I would go to their ribs and I palpate the sides, like intercostals. I palpate, and they're like, oh, no, I'm ticklish. And I'm like, this is cool. I'm like, let's have some fun. Sometimes I release their diaphragm, or I teach the technique that I'm going to teach you here, how to release the diaphragm. I go back and check. You should see the look on their face. Like, are you touching the same place? Are you doing the same way? I'm like, yes, I am. And all of a sudden, they're not ticklish anymore. So it's major. I love it. And actually, I'm so excited. On April 3rd, I'm doing an event with this yoga company, Yogis. And it's going to be all about breath, all about vagal nerve and phrenic nerve, that we're doing this amazing event together. Okay, let's see. Stress. You know, whenever we have stress, what happens? Your neck tightens up, everything locks up here, your jaw tightens, right? Because you clench. So I'm gonna start, it's already almost 7:30. So I'm gonna start walking through with some techniques, right? So the first one is, if anyone is sitting and watching, you can touch your jaw like this, just kind of touch up and down, and see if you feel any tightness, we call it
I feel already some, not pain, but something.
Tightness, it's thick, it's rubbery, tight.
Yeah.
And then feel the difference between right and left. Okay, now what I want you to do is, behind your mandible, if you put your thumb behind your mandible, it's kind of like a soft indentation, right? Do you feel that? Okay, now keep your thumb there. I want you to push tip of your tongue to the roof of your mouth. See what happens under your finger. It becomes harder, right? When you push your tongue, if you cannot reach to the roof of your mouth, just push your tongue behind your top front teeth. Do you feel how under your thumb becomes hard? Yeah? Okay, so you're gonna press that and wait for 20 to 30 seconds. You don't have to open your mouth. You can keep it closed. Just make sure you push the tongue. And make sure, I notice a lot of times what my clients do, because they concentrate on this so much, they end up doing this. Keep your head neutral. You can do this anywhere because no one can see what you're doing. Just put your thumb behind your mandible here. Press your tongue either to the roof of your mouth or behind your top front teeth. As soon as you feel that rubbery feeling under your thumb, just hold that for about 30 seconds. So once you do that, go back and check your jaw. See if you feel the difference. It should feel looser, right? Yeah. So what it does, it relaxes the muscles of mastication. It relaxes your masseter, your temporalis muscle, like your chewing muscles. And whenever you try to chew, try to use both sides of your mouth. Don't always chew on the same side. And definitely try not to chew gum.
Why not?
Because it really tightens your jaw muscles. I mean, I'm okay if you're gonna chew gum right after a meal to stimulate the saliva, to stimulate the digestive enzymes. But whenever you're chewing gum, what happens, your body, your mouth releases digestive enzymes. But if you're not eating, you don't need those enzymes. Not only that, every time you chew, you're pushing air down to your digestive tract. And those are not good. So now, since you know this technique, okay, whenever you have, we're gonna add to it, just one more technique that you can combine with. So whenever you feel like you're in a stressful situation, stress coming on, like I said, everything here locks up and you start clenching your jaw, right? So when you're doing this technique, now I want you to turn your head to whatever dominant hand yours. If you're right-handed, you turn your head to the right. If you're left-handed, you turn your head to the left. So I'm right-handed, I'm gonna turn to the right. Drop your shoulders and relax, and still do the same thing with your finger and with your tongue. And you're gonna hold that again for about 30 seconds or a minute. Take a couple of deep breaths. what that does, that actually breaks the pattern of the neck tightening up and jaw tightening up. I have a client who, when I taught her these techniques, she said since that time, she never, whenever she's in a stressful situation, her neck never tightens up or her jaw never tightens up. So definitely try it.
I felt pain actually. I don't know.
When you turn your neck?
Mhm. Yeah, I had pain.
Okay,
Back.
so like I said, I wasn't going to teach this technique, but I'm going to teach it because I want you to, I want to walk you through it. Okay. So when you turn to your right, you feel pain?
Yes.
Okay. So now what you're going to do is you're going to look straight. Keep your head neutral. Okay. Look straight. Now, your eyes only looking to left. If you want to keep your fingers to the left so you can look to your fingers, okay? Eyes only, do not turn your head. Now, what you're going to do is, as you're looking to your eyes, you're slowly gonna turn your head to the right, but still looking to your eye, to your finger, okay?
That's not that easy to do because I'm losing the sight.
I know, well, move it, move your finger,
Oh, okay.
but still just look to your left. Okay, when you get to a point that it hurts, stop.
Oh, I mean, it doesn't anymore. I don't know.
Okay, come back now. Come back. Okay, so I want you to look it and turn your head as far as it goes without pain. As soon as you feel pain, stop.
Yeah, I think I can turn it more to the.
Okay, now try it again. Try it again. Look, you don't have to use the finger, but I just say because.
Do I do the mouse thing still?
No, you do nothing with your mouth. You just, your eyes looking far left and head turns, but you're still looking. At one point, this weird thing happens in your head because your eyes want to follow the direction where your head goes, but you're forcing it to look the opposite.
I can turn so much.
Yeah, I can see it.
Further,
there you go.
than before. Oh my
Yes.
God. Yeah, I
That's
can
it.
definitely turn. It's my angle is wider now.
It
That's
works.
so
This
cool.
technique works every
Oh
time.
my God.
I even had a client that he's like, I've tried everything. My neck does not turn. I'm like, look, just try it a few times. If it works, great. If it doesn't work, it doesn't work. But he's like, that's the only technique that has worked on him.
Wonderful. I can turn so much. Thank you, Annie.
Of course. Now, there's another technique I want to teach for diaphragm release. Okay. So this one you can do sitting down, standing up, or laying down. Honestly, it really doesn't matter. And unless there is someone there with you that is like testing your diaphragm, I have no way of you checking if it worked or not. But I have not seen anyone that it hasn't worked on. So as you're sitting, your hands are on your sides, like hanging on your sides. You're gonna, it's a bilateral technique. You're gonna do both sides, okay? So you're gonna turn your head to the right. Your left arm reaches down. You're not tilting your body. It's just the arm, like you're reaching down to see the floor. So your head is to the right, your left arm reaches down, and I want you to cough, like deep cough, like, no, not.
Is it okay that I'm leaning?
I don't want you to lean.
Oh.
No leaning, just the arm reaches down. Do diaphragm cough.
Yeah, it becomes my stomach is like doing this.
Okay, cool.
Is that how it should do?
Perfect. Now you're going to turn your head to the left. your right arm reaches down and give me about 3-4 good coughs.
Okay.
And that's it. That
Oh, you know what?
releases.
I noticed that I'm really, my breath is more, like bigger.
Oh, you can
It's not
take
like
deeper
I
breath.
can, it looks like my stomach like blown up. I mean, I don't know how to explain to you the feeling. Like, I guess I talk with my stomach on, because before it wasn't participating.
Okay,
You know what I mean? Because I never got that far.
got it, got it.
But now it's like
Good,
the whole thing is kind of like, when I talk, it's kind of like working, like opened up, and it's
nice, very nice.
interesting. Very
Yeah, no,
interesting.
I love these techniques. They work amazing. I actually have a whole neck pain relief, like a self-help techniques course that I'm launching in a month or so,
Oh, that's
where I
wonderful.
teach like some of these techniques that I'm teaching now, but I also teach about like 15 other techniques that helps with the neck pain, and then also throughout the whole body pain.
Wonderful.
So the technique that you do this with turning your head, you can also use that as that also relaxes your fight or flight, your sympathetic nervous system, when you're under stress. So that technique, it also calms you down, relaxes your sympathetic nervous system. We
Yeah.
also know that a lot of times you can find tons of videos where you can they teach you to relax the vagal nerve, stimulate the vagal nerve.
Yeah, I wanted to ask you about vagal nerve, because it's such an essential nerve to the whole body.
It's great because it innervates in your tongue. Vagus nerve. The 5 cranial nerves innervate in your tongue, and vagal nerve is one of them. But it also goes to your neck, your heart, your digestion.
Mm-hmm.
So some of the easiest way to stimulate the vagal nerve is a loud singing. So when you sing in the shower, just think of you're stimulating your vagal nerve. Gargling,
Oh,
it
okay.
stimulates. Humming, that stimulates your vagal nerve. Okay.
Mhm.
So those are like the really easy way, or even if you collect some saliva in your mouth and hold on for about a minute, that also stimulates your vagal nerve and it calms you down.
But you don't spit, right? You keep your
No,
saliva.
you just collect the saliva, you hold on to it, and
Mhm.
then you can swallow or spit it out. I don't care what you do after a minute. But yeah, that would also stimulate your vagal nerve and give you a sense of calmness and relaxation.
Wow, so many techniques to relax. That's what
Oh,
people
there's
need.
so many more. There's so many more. Yes. But do you guys have any questions? I don't know what else. Let's see. I'm looking at my thing. I usually it takes longer because people are on their cameras, and I look at them, they do it. So we just it's a full conversation going back and forth.
Yeah, I wanted to still ask you about, in introduction, remember I wanted you to talk about those two, I can't find them, those two terms, neuro something, what they mean.
Yeah, one of them is how when you eat the food, how your body uses the food that you eat, and one of them how the genes act, like I said, how the genes react to your environment. Based on your genes, your body reacts to your environment. Nutrigenetics and nutrigenomics.
Mhm.
So based on like the foods you eat. Okay, so for me, I have, like, I have genes, couple of genes that I cannot do cannabis, like cannabis, like smoking pot, THC.
Yeah.
My body goes into adverse reaction. And I found it out the hard way. I puked for 2 hours. And one time I went into a complete paranoia, like complete paranoia, having a full-on conversation with myself, like freaked out. But if someone has those genes, they can also go into violent behavior or full-on psychosis
If they take THC.
if they take THC.
Okay.
Yeah,
But
CBD, no. But if there's a THC in there, they can have a complete adverse reactions. Actually, in May, I got asked to present. There's a Canadian nonprofit organization on cannabis education, and they asked me to present on what are the genes that people can have those adverse reactions to it.
so what you're saying that not everyone will be having the same reaction, because a
Yes.
lot of people say that they have this experience, but then other people want to have this experience. It doesn't mean that you will have it, right?
Absolutely. If
Yeah.
you have and it's so funny because I have, it happened that I have analyzed certain clients' genetic reports and they went, oh, no wonder I had this experience. Like they actually felt that they were having the adverse reaction. They just didn't know why, but because they had the genes.
Yeah, I actually tried the sleeping formula that has THC in it, and I think one time it's probably I took a little bit too much. I had a horrible experience, and
So you may have
I
looked
might
up
have it. Yeah, I'm just thinking I probably have it.
AKT1, that's the gene, AKT1.
Hmm.
If you have that gene, I don't remember if it's the TT variant, but yes, then that will give you adverse reactions. So you have to be careful.
Hmm.
Yeah.
Yeah, but I think smaller doses are okay, but just tiny little bit, and I didn't even know
Tiny
it was.
little bit, it's okay.
Yeah,
And then also it's okay if you're not doing every day.
yeah.
Yeah, definitely.
Okay. Well,
Yeah.
thanks. I'll look into it.
I don't know if anyone else has any questions or if you have any questions.
Maybe a couple more techniques if we can. Just just a little bit. I
Um,
don't know if people have questions, please ask.
Like I would love if anyone has neck pain and I can show something very specific to their stuff, to their pain. Otherwise, let's see.
But I've noticed that you're not touching the neck. Is that the thing? You will never touch the neck? I'm just
Oh no,
curious.
I touch. Oh, there are a bunch of techniques I do. It's just because a lot of times their neck just gets loose just by relaxing all this.
The
Because,
jaw.
okay, see the tongue, the root of your tongue is attached to your hyoid bone.
Uh-huh.
So when I release the tongue and the muscles that are attached to your hyoid bone, there is a muscle attached to your hyoid bone that goes and attaches to your back of your neck. Okay.
Mm-hmm.
There is a muscle also, deep muscle, goes all the way, attaches to your scapula.
Uh-huh.
So when I'm releasing your tongue, which I not only release from inside the mouth, but I also release from here and here, all these muscles I'm releasing. Then a lot of your neck muscles are loosened up. Do you know what genes are responsible for alcohol intolerance? Yes, I cannot tell you the exact like name top of my head, but yes, there are genes that can that you can be that cannot tolerate or also addictive. If you have certain genes, you can have more of an addictive personality. And that has to do some with like a certain dopamine genes in your brain and brain pathway, but I don't know by heart what are the names of those genes are. I'm sorry.
Mhm. So we all need to do genetic reports.
I think everyone should do, because that's something you do only once.
Mhm.
And we can dig deeper and deeper. You know, it's amazing the information you can get from the genes. Like when I did mine, I got so many aha moments. And one of the reasons I did mine, because that was my final exam for my nutrigenomics certification, is I had to analyze my own report. But I got so many aha moments, you know, even though I've been an athlete all my life, I've never been skinny. I've always gained weight easier and have hardest time losing weight. And then when I did my genetic report, I'm like, oh my God, I have like 10 genes that the food I look at food, I gain weight. It explained like why, you know, but
Wow.
also what I need to do to lose it, which is more sweating, like sauna, which good thing I
Mhm.
love saunas. You know, detoxification, my phase 2 detoxification is very slow because I have like a COMT-AA gene, which makes it 70% slows down the function of my phase 2 detoxification. So the body holds
Phase did you say
phase 2, like
uh,
there's, you know, in a detox, we have phase 1.
I don't know what it means. Can you explain,
Oh,
please? What is
sorry.
phase
So
one?
our detoxification has like 3 phases.
Mhm.
Phase 1, where the compounds get broken down. Phase 2, where they convert it into water soluble. And phase 3, where it goes out of your body, get
Mhm.
assimilated. So some people can have very fast phase 1 and phase 2. These are the people that can eat anything, they never gain weight, and you want to like slap them.
Yeah.
Some people can have very fast phase 1, but slow phase 2. And we see that when we do the genetic report. So for these people, we're like, okay, we need to slow down the phase 1 and speed up phase 2. Otherwise, the things can broken down. But if the body cannot convert it into water soluble and move it out of the body, then it can increase the inflammation, it can increase the oxidative stress, there's more things can happen. Okay, mine is just slow, very slow. So my body likes to hold on to its fat. I say it's a solid Armenian fat. It does not, it's like a premium fat. It does not dissolve at all. I have some American clients, you know, they like do liposuction. They get the fat from their butt to put it under their eyes. And then they have to do every so often because it gets dissolved. I'm like, honey, once you do my fat, it's solid, does not dissolve whatsoever. So yeah, but that's what phase 1, 2, 3 detoxification is.
So is it possible to do this genetic test, which will tell you exactly what to do?
Yeah.
Because
Oh, that's
because
exactly
I
what
did
we
it
do.
years ago, and they gave me just a list of genes and just tiny information, but it's not enough to act on, I guess, the way you said. I mean, I think your report is more complete. So where do you get their
So,
like that?
okay, I'll, if you go to my website, which I will put the address to
Yeah.
that link
Mm-hmm.
for you. So, you can actually download a sample report, but when I run the genetic report for the client,
Uh-huh.
you get a 31-page
Oh, so
beautiful.
you interpret it, right?
Oh yeah. Oh
Oh,
yeah.
it's
I
so
break everything down for you.
so we order it and give it to you and you interpret it.
You
Is that
don't
how
give
to?
it to me. It comes to me.
Oh, okay.
Yeah,
This is
this is like an amazing company. So I just
uh-huh.
put this link. It takes you to my website
Mm-hmm.
genetics page where
Yep.
you can get tons of information, but also there is a place where it says download sample report.
Uh-huh.
You can download the sample report, but usually what I do with the clients once they get the genetic report, is we set up a 1 hour Zoom session where I break everything down for you. We record it, so you get the recording of it. Not only that, I make tons of notes on your report. And on top of it, at the end, I give you like, I think 4 or 5 page action steps. What foods you should be eating, what foods you shouldn't be eating, what lifestyle changes you should be making. And then also, I like to also look at your blood work, because genetics is, it's a foundation. It's not a diagnostic tool. You don't diagnose with genetics. We say, and there is no, just because you have certain gene doesn't mean something's going to happen, or just because you have a, let's say, a high impact cholesterol pathway doesn't mean you're going to have a high cholesterol. Those are just the potentials. But when I look at your blood work, if you have normal cholesterol, then your life, yes, maybe genetically you're more prone to having high cholesterol, but whatever lifestyle choices you're making, keep it up because it's working. But if I'm looking, like I just did a analysis on a client who's a Hollywood person. So you look at her, I mean, she has gorgeous body, beautiful. She has a private chef. She has a private personal trainer. She has a Pilates instructor. And I've known her for over 10 years. I know she eats healthy, she exercises, and she's like 1/3 of my size. And then I look at her genetic report and I look at her blood work, and her cholesterol is like 250.
Wow.
And she's like, we don't understand why. Well, her genetic report told me why. It explained why it was happening. First of all, she had genes in her cholesterol pathway that, your liver makes the cholesterol, right? And it sends it out to your body, to every cells and organs. Whatever your body needs it utilizes. And then whatever it doesn't need, it's supposed to bring it back to your liver to recycle it. Well, she had genes that her body wouldn't collect the excess, bring it back to the liver. So that was one of the reasons that her cholesterol was high. And then she had a gene, HLA gene, that high impact that made her so she's very sensitive to gluten. I don't know if she's celiac or not, because that gene doesn't tell you if you're celiac or not, but it tells you that you're gluten sensitive, because you could have celiac disease or you could be non-celiac gluten sensitive. So I told her that, okay, next time, ask your doctors to run this very specific blood test that will determine if she has celiac disease or not, because she does have digestive issues. But there was an explanation why some of her blood work was the way it was, and her doctors couldn't figure out why, even though she was doing all the right stuff. And so that's what the genetic report can do for you.
Okay, wonderful.
Yeah.
Yeah, that's great. So order this test through you, and
you just go to my website. There is a place you can order it. And then once you order it, you get the kit, within a few days, they ship it to your house, and you scan it, the QR code, it tells you step by step how to collect. It's a cheek swab, simple, ship it back to them with the enclosed FedEx envelope. And then within 2 to 4 weeks, I get the report, and then we'll set up a Zoom session where I'll analyze it.
So do you
Very
work with
cool.
specific diseases people have? I mean, can you comment?
We can't, okay, so that's one of the things with the genetics. It's not a diagnostic tool. And like you said, you had the genetic report down, right? That they just checked a bunch of individual SNPs. There are certain companies that can test for diseases. Let's say if you had a family history of, like, every female in your family had breast cancer, you want to go get that tested, because there could be a very specific, they test the BRCA gene, like 23andMe test the BRCA gene but they don't tell you that they test only 3 to 4 different versions of BRCA gene.
Yeah.
But there is, I think, 23 or 25 versions of BRCA gene that they don't test.
Right. I know.
The
Because I
only
have
ones
twins.
they test is good if you're Ashkenazi Jew. If you're not Ashkenazi Jew, whatever they test, it doesn't even make any sense. Because then you can get a false, you're good.
Yeah. Yeah, I clearly they don't test everything.
No.
Yeah.
And then individual genes, let's say some doctors, they look only MTHFR.
Yeah.
And then they say, oh my God, that's all they do. But yes, MTHFR, there's different versions, like 677, if you have the TT variant, which is the high impact. But just that gene on its own, it doesn't have the impact to cause a disease. Yes, it's powerful, but it doesn't have the impact. Or ApoE, which can contribute to Alzheimer's. But just that one gene, it doesn't have the power to cause. Anything you do, your lifestyle choices are the most powerful.
Right. Right. Well, if doctors know you have that gene, they can say, oh, you have everything because of that gene,
Oh my God, no, not at all.
Well, I'm glad that you can break it down to like specifically this is gene can influence that. This can
Oh
influence.
yeah, no, it's so interesting. It is so interesting. Like I would encourage you guys to download the sample report.
So
and
how much
just
would
see.
it cost approximately?
You can see on my website, there is
okay.
no hiding on that. There is the different packages, but the first one is $597. That includes the testing and analysis.
Mhm.
Yeah.
Great. Wonderful.
Yeah.
All right. Does anybody have any questions to Ani?
I really thank you.
No.
If you guys end up with any questions, feel free to reach out. And hopefully you can use these techniques and or teach others.
Oh, I will be teaching my family for sure.
There you go.
I was in situations when we had that neck stiffness to the point that, my family members couldn't turn. They had to either side. That was even like that. Sometimes it's only one side, sometimes it's both sides, so I got so much knowledge. Thank you so much. This was wonderful.
Fantastic.
And
Thank
even
you.
I feel different now. My diaphragm is changed, now I can turn my neck much further than before. Like, see, it worked on me.
Fantastic.
I'm going to keep telling everyone there's Ani who can help, Wonderful. Thank you so
Very
much.
grateful.
It was so great. Do you have a YouTube channel or anything like that?
I do have a YouTube channel. Yeah, it's my handle is, oh my God, Living Pain Free. Oh my God. Let's see.
Is it on your website?
It's on my website.
Okay,
Yeah,
we'll find it.
The channels is on my website. Yes.
Wonderful. Thank you so much, Ani. I
Thanks,
really
everyone.
appreciate.
Appreciate
Yeah, I learned so much today, and hopefully we'll see you again. Maybe. with
Sounds
some
good. Thank you so
other
much. Very
techniques.
grateful.
Thank you. Great. Thank you.
Thanks,
Somebody wrote
Tatiana.
thank you. All right.
Have a good
Take
night,
care.
everyone. Bye.
Yes. Bye-bye.